Hello from EHA, where exciting data on acute myeloid leukemia are being presented. It is my pleasure to talk to you today about FLT3 and also why FLT3 mutation analysis is important for a good characterization of this disease. You know that FLT3 mutations are one of the most common molecular abnormalities in acute myeloid leukemia. There are two types, the FLT3 internal tandem duplication and the FLT3 TKD. And today it's very important to have this molecular alteration be well characterized, because now we have new treatments that are target to these mutations in FLT3, and therefore is very important to have a diagnosis on the presence of not of this mutation, and also to have that on time. We have now possibilities to give the FLT3 inhibitor, midostaurin, together with intensive chemotherapy in the upfront treatment of AML patients with FLT3 mutations. And we also have the possibility to give gilteritinib or quizartinib to patients who relapse. Quizartinib is still not approved, but will be in the next months or 1 year. So, and why it's important to detect these mutations? First of all, it's important to perform the analysis. Recently, we did a survey in our country, in Spain, and we have achieved this goal. So practically all AML in Spain are tested for FLT3 ITD, and in most of the centers, this is tested using the same harmonized methods. However, in other countries, particularly in those that are less developed or that do not have the drugs targeting this mutation available, not all the patients are tested for FLT3, and this is very, very important because, as you know, not only because of the availability of the agents, but because the FLT3 internal tandem duplication confers an adverse prognosis. And not only that, more and more is becoming evident that the ratio of the mutated allele compared to the germinal allele is also very important to be measured. And as an example, this ratio is included in the recently published ELN prognostic classification according to genetics. So patients with a ratio above 0.5 have worse outcome than those with a lower ratio when the NPM1 mutation is concomitant. So it's very important that for a good characterization of AMLs, we have at least tested several genes. For example, CBP alpha, the CBF rearrangements, also the FLT3 ITD and the ratio. By having the drugs that may improve TKD cases also, to look for TKD, and also and as well other genes like ASXL1, like RANKS1, like P53, because these last three genes confer adverse outcome to the patient. So in summary, it's very important to test for mutations in AML, particularly in FLT3 cases, to have the results back early. For example, for fit patients that are going to receive upfront treatment, we need to have the results not later than 5 days, and this is very important to incorporate to the therapy midostaurin on day 8. And also in relapsed patients, it's important to know whether we can give the FLT3 inhibitors which is approved or in clinical trials. So the goal that we should achieve is at least that the mutations included in the ELN category are tested in most, if not all, patients with this disease.